Yayak Onarato. It is May 8th. Welcome to the COVID-19 Task Force Daily Update. Joe Delaron Ujut's busy program today, and we apologize for the delay, but it was a long day. So hopefully we'll have information that is going to be very useful to you. We'll start things off with the Executive Director of Sagot again has Community Services, Derek Montour. Derek?
What Kahnawake, Aruyanas Ujuts. I offer my greetings to all of you as my brothers and sisters, and I hope all of you are healthy, safe, and happy. I first want to start by wishing all mothers, and especially my mom, and the love of my life, a very happy Mother's Day. All mothers really should be honored every day, just like all fathers and all people. At the end of it, mothers give us life on this earth. And I think more than any other day, of course, Mother's Day has recognized that. But in these challenging times, we often see family violence on a rise, and we often see challenges within homes. Please make an extra special attention this weekend to honor all of our families and all of our moms. I'm here today really quickly. I want to talk about the communications that we had put out regarding the hoped-for visit that we had started planning. We had put out communications yesterday, and I think in the Eastern Door today, to talk about a revised visitation schedule at the Turtle Bay Elders Lodge. We had hoped to start and launch this activity this weekend, but we realized that we were premature. We really needed to have more dialogue with the task force, more dialogue with our health expert, Dr. Gauthier, and we decided to step back. We postponed it. And we are looking at some additional measures to put in place. To give you some examples, we do want to look at visits by appointment only. We do want to look at maybe only a small set of family members visiting their family at any given time. We also only want a certain number of families visiting at once. So we're really going to be scheduling it that way. Of course, we're going to have a triage and a screening process when families first come to ensure that there is no symptoms of COVID and there is no risk. And we really are stressing that all families or visitors respect all the guidelines and measures we want to put in place. This really is at this point a one-time measure. We really want to put it in place, see how it goes. We're trying to ensure maximum safety that we can, and then we'll reevaluate if this visitation schedule can go on after that. We want to really make sure everybody's very comfortable with what measures we put in place. And of course, our primary concern is ensuring the safety of all of our elders out there. So you'll hear more. We're going to do some additional planning, and you'll hear more early next week, and we'll come up with a plan that will communicate once again to everybody. I apologize to everybody for this premature communication that we had yesterday, but of course it was all with the best of intention, and we're stepping back once again with the best of intention. If anybody has any questions, you're more than welcome to give us a call, and we'll clarify in more details. So thank you for this, and once again, please have a wonderful weekend. Now go on.
Right, now, Derek. And we had, like I said, a busy day today, a very important day. And to help explain, I guess, some of the developments that we've seen today at the COVID-19 Task Force, we'd like to bring on Lloyd Phillips. But before that, we'll start things off with Lisa Westaway from the Kahnawake Memorial Hospital Center.
Good afternoon. So I'm here to start a presentation about some of the elements that were discussed and decided upon today at the task force. And Lloyd is going to give you a little bit more information when he comes up after me. So I want to just go backwards a little bit to a few weeks ago when the task force had given the mandate to the Kahnawake Economic Revitalization Committee, a group of, again, I mentioned brilliant people, to start looking at the planning of reopening of business. So there are several hours that have been worked from that moment till today, and I'm going to present to you a little bit of the process that has happened over these past few weeks so that you have an idea of the work that was put into this process. So, and I hope I do it justice because again, I wasn't in those meetings that whole time, so I'm going to do my best to represent the work that was done by this committee. So this committee, first of all, had to document a list of close to 400 businesses in our community. So this was not an easy feat. They didn't have all of this information, and so this is a process that had to take place. And I think through this process there was a lot of dialogue that also occurred with business owners. So those of you who met with this committee or certain people from this committee can attest to that. So there was a lot of dialogue, because I think there was an element that was very important, was to hear what you had to say. And I know that there's a lot of there is a lot of frustration and a lot of information that has been asked of this subcommittee from business owners. So I think part of their responsibility, or part of the job that they ended up playing, was to really relay that information to the task force that came directly from business owners, and that was really important for us to hear. So from there, there was also a lot of discussion about how we reopen. What's the process that we're going to take? How do we find a balance between health and safety and economic revitalization and our livelihood? And so that really is the basis for every discussion and decision that was made, and it's the basis of the process that was developed. So this subcommittee developed a matrix. We have already spoken about it, which listed all of the industries. So they regrouped all of the businesses by industry. Could be restaurant, could be fitness, could be, I mean, there were many, about just under 40, I believe. And there was a decision made about criteria. How would we evaluate the level of risk in each of these industries to be able to establish phases for opening? Understanding that we want to open with the least amount of risk, so those who are those industries that are categorized as low or medium risk, and what criteria do we use in order to establish that? So some of the criteria, I won't tell you all of them, but some of the criteria, for example, were health and safety, economic, the economic importance, amount of volume of local and non-local, either employees or customers. There were also the ease in implementing some of the adaptations that we're going to be asking to implement. So those are a few examples of criteria that were used. So then we had not just the subcommittee, but people from different areas that had maybe different points of view, because we tried to make this as objective as possible. It's an objective document where we all scored this document. So each of those criteria were weighted by importance. So again, we talk about economic viability, the economic importance within the community, and health and safety. Those are our two most important elements that we want to make our decisions on, and so those were weighted the highest, and all other criteria were weighted accordingly. And then each of us individually, we had to score this matrix. So that took a lot, collectively was a lot of hours, and it was an interesting experience, because it really makes you focus on the industry itself and the adaptations that could possibly be required, and the facility and ease of doing so. And then the document, the matrix, was scored, and it was categorized into low, medium, and high risk. So Lloyd will tell you a little bit about the results of that assessment when he comes on. And so that was presented to the task force this morning, those results. And I just want to remind you that some of the elements that are especially important in the reopening phases. So first element is level of responsibility. So in order to reopen, it's extremely important that businesses take responsibility for the health and safety both of their employees, of their customers, and of their community. So that is an important element in moving forward. The other element that is especially important is identifying as quickly as possible anybody who is sick or has COVID-related symptoms so that they could either be tested or self-isolating depending on the symptoms, and that's a variable that is extremely important and will dictate whether we have success or not. Also, what's especially important is the adaptations, environmental adaptations, psychosocial adaptations. All of these elements are very important, and the last but not the least is all of the community mobilization. So we've said it very often, and Lloyd will probably repeat it, but what is happening in and around our community will be especially important as we move forward towards an opening. And it will dictate success, meaning we have to continue to have physical distancing. We have to continue to self-isolate when we are sick or have symptoms in order to ensure that we do not transmit the virus, or as minimally as possible. We know, and it's been said many times, but it's important to repeat it, that when we head towards a reopening, that we will experience increased cases and increased sickness and possibly death as well. And so we will move forward with our phases very, very slowly in order to follow that closely and mitigate the amount of risk as much as possible. So I'm going to just remind you, I'll just show this quickly. This was the kind of the model that we had established. I don't think you need to get in close because I spoke about it the other day, and you can go back to that if you like. But just to remind you of the supports that we have in place. The occupational health and safety and surveillance, and also the local public health for contact tracing. So there are, Dewa Danizakta is there as well to help businesses, and there will also be financial support, but we're going to talk a little bit more about that afterwards. I think I'll let Lloyd come and speak about some more elements of the plan, and then I'll come back and talk more about supports. Thanks.
Thank you, Lisa. Yeah, just on the same note, I know a lot of the talk in the past week or so has been talking about the revitalization of the economy, which has been was our primary focus today in our discussions. And as Lisa outlined, there was a lot of work happening. But what I also want to remind and underscore with the community is, we are still in a pandemic. Now, even though we're talking about the future, you have to remind ourselves that we are still in a pandemic. And even though even all the news outlets on CTV and CBC or wherever one you watch is all talking about recovery, it's talking about next steps and so on. But don't lose sight that we are still in a pandemic, and there still is 100 on average deaths per day happening. In the Montreal area and throughout the province of Quebec, like I said before, right on our back door. And if you really look at the information as well, we all know Montreal is they're calling the epicenter of Canada, has the highest amount of cases, has the highest amount of deaths and hospitalizations, obviously because it's a large metropolitan area. But if you take that and you put that in terms of the population, the rate of infection and the rate of death is the same, in the South Shore, Montérégie region as it is in the city. Just that there's less people, so there's less numbers. But if you do it on a percentage basis, it's just about equal to that in the city. So I think that's important to note, remind people, before I get into more of the presentation, that we are still in the midst of a pandemic. So with that said, what I want to touch on next is some of the score and some of the matrix and some of the discussion that took place today regarding more specific into businesses, and we had broken it up into two groups. Originally we were talking about maybe 3 or 4 different phased in approaches, but what we decided is probably the best and fairest way is to get as many businesses, to the starting line as we possibly can, on day one. So when that's green light is given, as many businesses are ready to go. They have the proper safety precautions in place. They're well aware of what's expected of them as an employer, and so on. So I think that's important to note. And then the phased-in process, that we're talking about would be more about the businesses who won't make phase one, and then as time progresses, we will be able to assess the individual needs of specific businesses and phase those in as time permits, based on, again, medical information, based upon what's happening around us. So again, there was lots of work that was done on that area, and at this point, we have this I'll call it a solid draft plan that's there. Nothing is etched in stone, because things could change, things could evolve, and as time goes on. But we want to make sure that we're as clear and as transparent with the community as we possibly can be. But again, I always say we have to put that little asterisk there, because things are in draft form and always subject to reassessment as things go on and new information becomes available to us. So with that, maybe I could turn to the screen here, and we're looking at is the Kahnawake COVID-19 Task Force dated today, reopening, phase one. And as you can see, it's broken down in a number of categories of industries. And as you can see, a vast majority of them are in green. So those are the ones that we're looking at and say, when we give that the green light, all the ones in green, are the ones that are ready to go from day one, provided that they have put in all the proper protective measures that's required. And there are a few that we have deemed that they are not going to be part of phase one. These are the ones that will have to be phased in over a period of time. And the list, starts off, includes bars. It includes restaurants with sit-down dining. It includes gaming establishments, social clubs, fitness and gym facilities, as well as any type of hair salon or beauty parlor. And that's based on the fact that there is a high volume in some cases, which would equate to a gathering, which gatherings are still at this point not to be taking place. Also based on either high contact areas where there's a lot of people touching the same areas, high touch areas as well, high interaction. So those are things that would determine something that has to wait further, as well as not having the ability to respect social distancing. Because social distancing is going to be something that's going to remain for the foreseeable future. So if a business can't meet that basic criteria, they'll have to wait again until phase two. But for the most part, the rest of the industry is, the business would be able to have that starting date and ready to go. And as we speak today, we're not prepared to say an exact date. We will do that very, very shortly, because we want to look at it from a medical perspective. And talking with Dr. Gaucher today and looking at what's happening around Kahnawake, as we know, our neighboring communities have opened some of their retail establishments last week or this week, and they'll open next week, and then have them see what are the implications of that. Is there going to be a sudden spike in cases? Is there going to be a sudden spike in deaths or serious illness, within the surrounding areas? And that helps give us a good indication on the speed in which Kahnawake should take, and how we should adjust our measures accordingly. Because again, like I said, Kahnawake, we are a more vulnerable population than Chateauguay or Saint Constant or anywhere else. That's why we need to be extra vigilant, extra careful to ensure that what we do, we have the least amount of negative impact on our community. Mainly, our elders. Make sure we're protecting our elders and keeping them safe as we possibly can. and that's what has been driving, the direction of the economic revitalization plan. And we're going to continue to roll this out and give more information throughout the weekend and into Monday, and move in again as quickly as we possibly can. With that, what I'm going to do now is I'm going to turn it back over to Lisa for a minute, and she's going to talk about some of the draft documents that we have that will be made available to the community in the next little while. Thank you very much.
So we spoke about supports. How is the task force going to, and other community organizations, how are we going to support the community through this process? And so we spoke about it a little bit in the model, but one of the first things is documentation. So we want to make sure that you have access as a business owner to all of the information that you require in order to be able to open your business. So even though you might have been in the green section of that slide, if you are not able to make the adaptations that are required of you, then you will fall into the red section of that slide. So this is very important. And although we're not giving any dates today, and although this is the draft proposal that we're making to you, we want to give you the time to start organizing yourselves so that you will be ready when we announce a date. So the importance is that you have access to this information, and so we will have printed. So let me first talk about what the information is. Basically, we've prepared. Not me, but some really two great people, Tracy and Robin, have prepared and Leslie, have prepared packages for you to assist you in the opening of your business. So there will be packages per industry. So construction, for example, manufacturing, and there are also many extra documents, for example, employer daily checklist, all the documents that you are going to need to support you, assist you, give you knowledge so that you can prepare for the opening of your business. So these documents, we will have them in print form, and they will be accessible through Dewa Danizakta, and we will also have them uploaded onto our COVID-19, the KMHC website, and they'll be organized by Justice in a really organized fashion, probably by tomorrow. So we're hoping that that'll be complete tomorrow, but this weekend at the latest. So by Monday, if you go onto our website, you will have access to this documentation. The packages are all ready to go. How else are we going to support you? So we've already mentioned that there will be occupational health and safety inspectors. They also are very knowledgeable. They've already been assessing, supporting, consulting with businesses that are open presently. They've been also evaluating and verifying conformity of standards. So they're going to be a good source of information. Dewa Danizakta will be available also to provide support in assisting businesses to develop their reopening plan, to also implement adaptations that are required. They'll help with financial resources as well. And we know that there's the Kahnawake, the Economic Relief Fund that also will be providing financial support, and that will be clarified most probably next week. But we are expecting support for businesses through this process of reopening. So the last element of support is the local public health experts, and in your package you'll have a decision tree with phone numbers so that you have access to them when you need them. And of course, all of this together will provide a very comprehensive support to you as a business owner in order to facilitate reopening of your business. So I think for today, that's the information that we wanted to provide to you. I hope that you'll find this helpful. We're, of course, going to talk a little bit more about all of these measures over the weekend, and if we have more information over the weekend, we will provide it to you as we have it. But just to complete with a thank you to all the people who worked really hard on making this happen. I know you may have been expecting a date today. We feel for the medical reasons that Lloyd mentioned that it is not, that we cannot provide a date today for reopening, and it is really important that we follow medically what's happening around us, and so we hope to be able to provide that to you shortly. And so that's it. We'll see you tomorrow. Thanks.
I thank you very much, Lisa, and thank you, Lloyd. An incredible amount of work has taken place over the past few weeks to get to this point. It's not only incredible, but it's hugely important, and it just goes to show that, you know, how seriously everyone is taking this. So be on the lookout. It will be posted probably by tomorrow. We will have an update tomorrow, as we do every day. And at that point, we can confirm or give an estimated time when it will be, these documents will be posted. But it's very important, so we appreciate your patience, and we'll be ready for that. Just a couple of notes here before we leave. It is Mother's Day this weekend, this coming Sunday. And as Derek mentioned, happy Mother's Day to all the mothers. If you're lucky enough to still have your mom with you, make sure you give her some good wishes. There are some things going on at the Kahnawake Memorial Hospital Center. For example, you will be able to bring some certain gifts to your family members who are there for Mother's Day. We talked about that over the past few days. And you can bring, there's a whole list of things you can do and can't do. Just go to the COVID-19.KMHC.ca website, and it'll tell you what you can do. And you bring it to the testing center, bring your cards. Don't, like for example, don't glue them shut, leave them open. They have to do all of the things that they have to do. So that's between 10 a.m. and 1 p.m. on Sunday. Bring it there, and they have staff on site who will bring it into the hospital for the patients. And it'll be at the testing site, which is on the side of the Kahnawake Memorial Hospital Center. And finally, something a little fun at the MCK Facebook page. You might want to check this out. Look for the Mother's Day post and comment on the video wish for your mom. You can post a wish right on the site, and film yourself. And what we'll do later on is offer some prizes. We have some nice prizes, a couple of Shop Kahnawake gift certificates. So if you do it in English or in Ganyageha, your choice, we'll have a prize for both. And you can post till 11:59 on Sunday evening. And then we'll announce the winners on Monday. So that's it for now. On behalf of everybody here, a lot of work done this week, an awful lot of work done today. We thank you for your time, and we thank you for joining us. Thanks to the technical team here who've put this all together. So we'll see you tomorrow. Nyao ko dano, onigiwahi.